afternoon, everyone, and welcome to this session on the role of science in global responses to crises, lessons learned from the COVID-19 pandemic. I'm Gail Cardew, I'm Vice President of EuroScience, and I've been involved in ESOF since the very first one in 2004. Now, when the governing board of EuroScience and the local Trieste team were taking the decision to postpone ESOF, which I'm sure many of you know already was originally scheduled for July, we agreed that there was never a more important time to have discussions about the interface between science and society. It feels like everything we've ever learned about this important interface has had to be rapidly deployed to help manage the COVID-19 situation. And yet the execution of this situation was not perfect. So the governing board and the local team agreed that it was the role of ESOF to provide scientists with a space for self-reflection and to discuss what went well and most definitely what did not. So it's in this context that EuroScience organised this discussion today, along with our friends in South Africa and in Japan. So welcome everyone. So I'm the moderator for this session, and we will have 3 talks this afternoon. Each talk will be 15 minutes long. First of all, we will hear from Michael Matlotz, who is the president of EuroScience. Then we will hear the perspective from Japan from our friend Mishinari Hamaguchi, who is the chairperson of the Japanese National Commission for UNESCO and of the Council for Science and Technology at the Ministry of Education, Culture, Sports, Science and Technology in Japan. And then finally, we will hear the perspective from South Africa from Phil Majwara, who is the Director General of the Department of Science and Technology in South Africa. As I said earlier, each of these speakers will have 15 minutes to give us their thoughts. We will then have a discussion amongst the 3 of them. There may be areas of common interest or areas of disagreement that they will wish to talk to. And then we will have a discussion with all the audience. So I would encourage all of you out there who in the audience that if you have a question or an important point, please use the Q&A function to ask your questions throughout the presentations. Don't leave it to the end, but please, if an inspiration strikes you, please put forward your question. Those of you who know me very well will know that I like a lot of audience interaction. So I really encourage you to feed through to me all your questions. So that's enough from me. Without further ado, I'd like to hand over to Mike, who will give us the perspective from Europe. Over to you, Mike.
Okay, thank you, Gail. I'm very happy to be here, and I'm very happy to be participating in this particular session. This is a really important session for us because it's the opportunity for us to express what we feel is really important about an ESOF conference, which is thinking about how what is happening in the world is affecting us. And this is really exceptional this year with the COVID-19 pandemic and the global crisis that we are currently experiencing. This is really an unprecedented case in many ways, where so many scientific disciplines, medicine, mathematics, social sciences, economics, and many others have been placed in such a high-profile spotlight in society. This is really unusual, and we believe the lessons learned from this particular global crisis, in which science is really much more central than it has been in many others, can be used for dealing with other major challenges, which have a scientific and technical component, such as the climate change perspectives that we need to work out over the next few decades. We are here in the presence with the COVID-19 pandemic and global crisis, truly in the presence of a profoundly transdisciplinary problem. And transdisciplinary for science in the sense of what the Germans call Wissenschaft, which is all of knowledge, including the social sciences, the humanities, the physical sciences, and the life sciences. And I think this is clearly a case where the interdisciplinary nature of what we are doing is particularly present. Science, under the current situation of the pandemic, is under enormous pressure from public opinion and is being placed also under intense public scrutiny that goes to the heart of what science is, how science works, and how the scientific contribution during the COVID crisis can and should be communicated. It's something that is really exceptional in the sense that in many other crisis situations, there was a need for scientific contribution, but not as central as what we have today. I just want to say a word before going further in my remarks about the word science. Science in English is a polysemantic word and means a lot of different things to different people. And in particular, in the current crisis and the communication difficulties that we have had, one of the reasons may be differing expectations based on differing ideas of what science means. I'd like to just focus in this talk about three particular meanings of science that are relevant here. Now, one of the meanings is related to knowledge, and knowledge as a living corpus of facts and ideas, more or less stable in time and more or less subject to change. And this is sometimes what we mean by science. But there are other possibilities when we talk about science. Another possibility is method. And in that case, science is a professional activity using a specific method for exploration, discovery, understanding, based on observation, hypothesis, and critical examination. That is what scientists do. That's their job. They look at things, they observe things, they think about hypotheses, they criticize each other, and they criticize those ideas. And that is how they contribute to that corpus of ideas and facts that we consider to be knowledge. But there's a third possibility, and that is expertise. And in fact, this is what the general public in this case of the COVID-19 pandemic is really expecting. And this is providing expert advice on the basis of understanding of the current state of the corpus of knowledge to identify the ways forward faced with a particular situation. That is really what has been really at the center of much of the controversy over the last few weeks and months. And we had a wonderful session yesterday here at EuroScience precisely on this issue. The session was called What versus So What? So what is the corpus of facts and ideas enriched by the research method? But so what is advice on what to do? And this is at the heart of the communication problem. In reality, when faced with a global crisis like the COVID pandemic, our fellow citizens and other inhabitants of the planet are actually expecting solutions to the problem and not expecting information on what we believe is the current state of knowledge. And that leads sometimes to misunderstanding. And this particular communication problem has never been more visible than in the current recent months regarding the COVID. And one of the reasons for that is, of course, the very strong multidisciplinary nature, but not only that, also the speed with which new information has been gathered. And this is making the corpus of knowledge and ideas a little bit less stable and permanent than it has been in most cases in the past. And in this connection, there was a wonderful session this morning at EuroScience presented by the Research Data Alliance concerning their recommendations on data sharing as a living collaborative legacy. And what's interesting about that in the COVID context is the extreme importance of not waiting for scientific consensus, not waiting for peer-reviewed publication, not waiting for articles to appear in scientific journals, but rather opening up the data and the hypotheses as soon as possible and at the all stages of the research process. And this is a little bit unusual. Normally, what you see in the public eye are research publications, which have already been reviewed and looked at and then published in learned journals. But in this particular case, everything is going out immediately. And that's because the crisis is so important and so critical. In this new context, we're really taking off the cover and showing all of the public what actually is happening behind the expertise, the so what, the reality of the scientific method. And the reality of the scientific method contains uncertainty, it contains doubt, and the method itself is based on critical examination. In some areas and in some countries, this has actually shocked the public opinion. They were very surprised that some scientists didn't agree with each other, and that some scientists were presenting things in a different way because they were from a different disciplinary area. And I think that although this crisis in communication and explaining what science is and how it works is, of course, a danger for science and a risk for trust in science, it's also an opportunity because never before has science been so much in the spotlight of public opinion. And there are expectations that science will be better understood coming out of this. The opportunity is a clear, concrete contribution to helping society, but provided that the scientific community itself accepts to engage with governments, policymakers, businesses, and the general public. Now, of course, everything I've just said up until now, over the first, I would say, majority of my presentation, is probably also true in Japan and in South Africa. But one thing is different here in Europe, is that Europe is a very diverse place with many, many different countries and many, many different national policies. And so, in fact, diversity makes a perfect testbed for approaches to use, or in some cases, misuse science advice. In the same geographical region on this planet, with the same virus, we have an enormous diversity of approaches that have been used to face up to the current pandemic. And hence, this gives a unique perspective in Europe over a wide range of attitudes. And I can just cite over that range three positions which have been adopted by different countries in Europe, and which each has some advantages and each has some disadvantages. One possibility, and this has been done in some countries, is to actually delegate the decision-making to the scientific advice mechanisms as a de facto decision maker. Now, this has some advantages, but it has tremendous disadvantages in the sense that it reads the risk for our democratic institutions. So the scientists who are providing the advice are not elected, and they are not necessarily the most legitimate to be making important decisions for the society. A second possibility, which has been adopted in some European countries, is transparent communication on the scientific advice itself, but decision-making assumed by the politically decision makers and the elected leaders. Now here, this has an advantage of better transparency in some ways, and also the responsibility of elected officials. But at the same time, there's a tremendous risk of confusion, of disinformation, and reduced trust, not only in the scientific advice, but also in the politicians. And I think this is one of the alternatives, but also has advantages and disadvantages. And then there's a third possibility that has been used by some countries, which is to take science advice into account, but in a confidential way. And then the decision makers are presenting their decisions to the public without any communication about the input from the science advice. Now, of course, here's a risk for transparency. Of course, the risk also to give the impression of conspiracies. And I think that, as you can see, I've given you three possible ways of doing this, and all three of them have advantages and disadvantages, and all three of them are being tested currently in Europe. So I think we have a continent which is really an interesting test bed for this. We believe that science practice must be adapted to this new context, but that there's really an opportunity to come out of this crisis with science being perceived in a more trustful way and being better understood. Of course, that requires some effort on everyone's part, including the scientific community itself, and EuroScience, the association that I am the president of, would like to help. Our EASOF conference is an opportunity to look at these things, and EuroScience believes that now is the time for science to become a more integral part of public discourse. EuroScience wants to facilitate respectful, responsible dialogue, and it's our mission that the diversity of Europe, with all the different approaches that are taken in the different countries on our continent, will enrich the lessons learned and not diminish the value of what we live through. So thank you very much for listening to me. And I'm looking forward to hearing how our colleagues in Japan and South Africa are also looking at this issue. It's very complex, but I think it's also very enriching.
Wonderful. Thank you very much, Mike. And would the lovely IT tech people behind the scenes now connect us to our second speaker, Missionari Hamaguchi. Over to you. Thank you.
Can you hear me? Can you hear me? Okay. Thank you very much. Thank you, Gail. Good afternoon, excellent participant. I'm Michinari Hamaguchi from Japan. Let me express my heartfelt thanks to the session organizers for inviting me to this conversation. And I would like to express my great sympathy for those still suffering from the infection. Although we are still struggling with the situation, I would like to try to share what Japan has learned regarding with COVID-19 society so far. I believe the key point is citizens' empowerment. we need to distribute sufficient knowledge and information for citizens to empower them to make decisions by themselves for their daily life. This mirrors each of 2020's motto, freedom for science, science for freedom. Regarding the situation of Japan, the impact from COVID-19 has still remained relatively small. I can say it's small compared with other countries. As of the end of August in Japan, the number of infected people per million was 536, and the number of deaths per million was 10. I think total number of the deaths is still 1,300. So relatively small. This is approximately 1/10 of the world average. Foreign policy, an American magazine described Japanese situation as a mysterious success because the Japanese government has not enforced, but just requested gently to the citizens to stay home. It sounds, I guess, strange, but the government requested just stay at home, just requested. Citizens were informed of the risk and the most effective methods to prevent the spread of infection, but not forced into action. This is a somewhat akin to informed consent, because I'm a medical doctor, basically. I know it well. In case of medical treatment, the doctor's role is to provide the patient with sufficient knowledge to make their own decision. The patient is both enabled and accommodated. We don't force the patient to accept some treatment. By being given responsibility, citizens have acted with responsibility and followed the suggestion guidelines, making their own decision while being mindful of the effect on others. I think this is the point this time we learned from COVID-19. Additionally, I believe the well-established health insurance system has significantly contributed in our case. Everyone in Japan can access enough medical resources. This kind of social system is essential at the time of emergency and should be prepared in ordinary times. Also, risk management must be systemic. In Japan as well, an expert panel was established in the government at the beginning of this crisis. One of the experts, Professor Hiroshi Nishimura, who studied a mathematical model of infectious diseases, presented numerical target to reduce contact among people. There are many discussions, but I'm sure that his message has reached to the public. He was called 80% uncle in Japan because he suggested avoid 80% of contact opportunity that can stop infection, and avoid 3 C's. What is 3 C's? It contains first C is closed space. Second C is crowded place. And third C, close contact setting. Avoid these 3 C, closed space, crowded place, and closed contact setting. Avoid these 3 C's helped people to make decisions by themselves. We repeatedly announced these information to the people. I also once again recognize the importance of education. This kind of science communication cannot be realized unless people have equal learning opportunity. So education is a baseline for the communication. And also good education, I can say, can mitigate the effect of made by disasters and give us, I think, brave heart to recover from the stress. Furthermore, we learned through the past disaster, the devastating East Japan earthquake we had in 2011. At that time, we considered how research and development should contribute to crisis response. So we initiated a new urgent program called J-Rapid. The important thing is to realize a speedy support to the people, aligning various research areas towards the same goal to recover from the damage. We activated the program again this time. Although the amount is not so much, the important thing is promptness. In the meantime, many universities have been under lockdown. Those researchers need remote working. So digitalization and robotics of research environment is our urgent task. This can also be much improved by speedy funding support. As in other countries, daily life has changed significantly in Japan. We need a way to deal with prolonged period of infection by saving life and economy. I know the development of vaccine is an urgent task. This is a first choice. So we call it a plan A, but in other way, we need plan B. That is, to gather every scientific knowledge we already have. We are living in 21st century, not 19th century or early 20th century. Gathering all the knowledge to provide safe social and economical activities. It is what we called Plan B. For example, this is a typical mask we developed. This mask has antibody against COVID-19. So we can prevent infection by wearing this mask. I think this is one way, but we can try by exploring a range of research areas, including mathematical science, information technology, mechanical engineering, robotics, social science, and more. Taking a multidisciplinary approach to multi-phased crisis, we call it Plan B. We are now trying to develop it. We are trying to accommodate a wide variety of inputs in order to find the most appropriate output, giving our researchers the freedom to generate unique innovation at this time. As in other countries, daily life has changed significantly, but we need a way to deal with prolonged period of infection by saving life and economy. This is a reason why we need Plan B. And I would say it saddened me to see the spread of facial recognition cameras, biometric sensors, and other tracking technology to reduce the infection. But it's clearly limit freedom of movement. We have some kind of choice. We have to select one way or another way. But I believe this tendency toward totalitarian region styles, surveillance, and nationalist isolationism will, as forewarned by Noah Harari, begin to suppress thought, creativity, and ultimately innovation. We need freedom of mind, freedom of moving. So I think this is important not only for overcoming COVID-19, but for ensuring human well-being. We are facing a kind of choice we have to select under this stress. And in case of Japan, we rather choose freedom. That's the way we are trying. I would like to brought back to the words of the late Dr. Tetsu Nakamura, who dedicated his life to improve the living standard in Afghanistan. He passed away recently. He said that Afghanistans wished for only two things. One is 3 meals per day, and the other is living together with family in their hometowns. This is a core requirement for well-being. Despite the difference in individual values, perhaps fundamental human needs are not so different. What part is same, we can share together. So let's start to create a place for global cooperation to listen to the people's voice and share knowledge to empower them. I realize again that the most important thing is science should contribute to global well-being. It is the first pillar of the declaration adopted as a World Science Forum last year. Anyway, thank you very much for listening.
That's terrific. Thank you so much for Professor Hamaguchi for your thoughts. You've made some very interesting comments, which I would like to pick up on later on. But if we could ask now the very helpful technicians behind the scenes to put the third speaker on the spot now. So Professor Majwara, would you like to give us your thoughts from South Africa? Thank you.
Okay, can you see it now? Everything working well? All right, so just to go back to the points that have been made earlier on by Michael, in the way that we've handled the pandemic in South Africa is slightly different than in some parts of Europe because the Department of Science and Innovation was supporting the Department of Health. So within the Department of Health, the minister set up a ministerial advisory committee. And it is that committee with a group of scientists, both natural scientists, health, biomedical scientists, as well as economists, because the worry was that the pandemic is not only initially, of course, biomedical, but we then had to also start looking at the social and the economic aspects. So my talk will focus on the contribution that as a Department of Science and Innovation, we then made to this ministerial advisory committee and then ultimately to a political structure which is called the National Coronavirus Command Council, the NCC. And I've got a list of areas of work that we then had to support the management of the pandemic. I will not speak to all of these areas because I only have 15 minutes, but this just gives you a flavor of some of the things that we participated in. Testing both the PCR, polymerase chain reaction, and the point of care serology. This was very, very important at the beginning, and I will spend some time talking about your second definition, Mike, of how you use knowledge and science in order to provide support to decision making. Of course, in South Africa, we were concerned about how the pandemic was going to play itself out in communities and hospitals because we have a large prevalence of people with HIV and TB. So the Medical Research Council had to embark on surveillance studies to make sure that we understand how these patients were affected by coronavirus. And then, of course, therapeutics. We participate in a range of both global as well as own South African studies on therapeutics. Immunological studies. Again, we've started to look at some of the natural products in terms of the immune systems and how robust these are or were. And then we are participating in about 2 or 3 phase 3 clinical trials in partnership with partners from the rest of the world. But as I say, in the interest of time, I will not talk about those. Convalescent sera studies, monoclonal antibodies. I will say something about molecular epidemiological studies, data modeling, and I'll give you a flavor of the international partnerships that we worked in. So as you would anticipate, South Africa's dependence on reagents sourced from international companies was unsustainable because of the increased global demand. Fluctuating exchange rates and limited transport options affected the supply, resulting in an urgent need to source these components locally. Everyone was concerned about these reagents. Therefore, as a department and our entities, such as the South African Medical Research Council, and one of the agencies called the Technology Innovation Agency, we put out a call for locally manufactured reagents in July, and 7 funding awards to local companies, organizations, and researchers were awarded in order to ramp up the country's ability to produce locally developed reagents, as well as test kits for COVID-19, because there was a shortage, and this was the first need for us to make sure that we are able to get a handle on the pandemic. The call and awards focused on the development of diagnostic reagents and rapid detection kits. And there were companies and organizations that received awards which either were supported by our department or they were an entity, including private companies that we supported. Just to give you an example, our Council for Scientific and Industrial Research, which is one of our public research organizations, received a grant that would expedite the manufacture, the local manufacture of viral nucleic and isolation kits for nasal and oropharyngeal swab samples. And the CSIR worked closely with a number of spin-out companies on this project. So this was a public-private partnership that drove this initiative. A company that was a spin-out company from one of the public research organizations called Cape Biotechnologies, then supported by ourselves, received grant for the development of application-ready rapid testing PCR reagents for COVID-19. So this company, we had later on that it received orders even from America to produce these rapid testing PCR reagents. And then this category, of course, of rapid testing kits focused on rapid detection of the presence of SARS-CoV-2 viral proteins and or particles and exclude antibody tests. And as you know, a rapid detection offers a number of advantages over the usual PCR diagnostic methods, because these can be administered on the spot and the results can be read within as little as 15 minutes. So in certain instances, in certain parts of South Africa, which are in the rural areas, we think this was a very, very good and a useful technique that we funded and supported the management of the pandemic. And then the third initiative was the production of the ventilators. We didn't have sufficient ventilators in South Africa like everyone else. And then our president established something called South African National Ventilator Project to tackle this challenge. And then we were then called in as a Department of Science and Technology, working with our sister Department of Trade, Industry and Competition. And we then called on one of our entities, the South African Radio Astronomy Organization. And it's counterintuitive that a radio astronomy organization would work on a ventilator project, but this is the organization that is responsible for the rollout of our square kilometer radio astronomy. And because of their system design, integration and system engineering capabilities and project management, they were then asked to assist in this activity. So just to give you a sense and a picture, this is a medical technician holding the entire device, showing the blending unit and the patient mask. And the device supplies pressurized mixture of ambient air and natural oxygen to the patient through the mask hood that you see at the end of the picture. And then, of course, the pressurized gas, the blending device helped the pressurized gas to supply to the patient the higher level of oxygen and keeping the airway and lung pressure elevated above the surrounding air pressure throughout the breathing cycle, ensuring that the patient lung is operating effectively. So this was a very, very important demonstration of the scientific local capability in order to meet a shortage. So this is the third example of the work that we do. The third one that we are extremely proud of is an investment that we had made in 2001, so to speak, when we launched our biotechnology program in South Africa. In one of the universities, University of Kwazulu-Natal, we set up this KwaZulu-Natal Research and Innovation Sequencing Platform. We call it CRISP. And of course, it was supported by ourselves through an entity called the Technology Innovation Agency. And what the company or this platform did, it trained 1,000 health workers, produced genomic protocols, and capacitated dozens of laboratories, not only in South Africa, but in Africa to respond to the COVID-19 pandemic. And what it did, it began the whole genomic sequencing of the virus to track how and when it was introduced into the country. So this was extremely important information, and this data helped to understand how the virus arrived in South Africa, inform policy early on in the government's response. So this was a very, very important. So this is just a DNA sequences to map the viral evolution for diagnostics, vaccine, and therapy development. And this work continues to be done in this platform. And we are happy to announce that CRISP has now been invited by the World Health Organization and the Africa Center for Disease Control in July to join the Genomics Surveillance Network and the Network for Genomic Surveillance in South Africa, which was launched in June, providing a very, very useful platform for key collaborations between 5 national health laboratory services, virology labs around the country and the neighboring academic institutions, and thereby information was made, provided valuable information in managing the pandemic. Then the fourth example is, this is a picture of, as you can see at the back, the National Department of Health COVID-19 Information Center. Even though this was a data center that was set up at the Council for Scientific Industrial Research, you can imagine that for this data center that had a screen that was providing real-time analytics and dashboard on the outbreak per each of the province, district, and local municipality and ward in South Africa. But as you can imagine, there was a lot of data analytics and science behind what was provided in this dashboard in order to provide decision-making as shown. And as part of the national data-driven approach to countering COVID-19, the CSIR has developed a platform that monitors mobility of human beings to better understand movement patterns across specific areas. So even during the lockdown, we were able to track the movements and also the virus hotspots. So we were able to know where the hotspots were, high risk and vulnerable areas. We developed a vulnerability index, as well as monitor lockdown compliance and the spread of the virus. So this was a very, very important technique using data analytics and a variety of expertise. And this was hosted or supported by the Center for High Performance Computing, because for you to be able to do all of this work, you needed this behind the scene. So we also had community health workers that was recording screening data and symptoms, and they were transmitting the information to the center, and this enabled near live display of the household screening and the testing program. So all of this information was fed to the Ministerial Advisory Council for decision making. What has happened now is that this data center has been asked to be converted into something which we call an observatory. And government wants to use the expertise that was established during pandemic COVID-19 to have an observatory beyond COVID-19 related activities. For instance, at this point in time, we have to use this to see whether we know the super spreaders and how the super spreaders could probably be managed before we get the second wave. We've been asked to track the social recovery, the economic recovery, and therefore this platform that was designed for COVID-19 is now being used as an observatory that will use open science and will bring in multidisciplinary scientists to try and solve the problems of the country beyond COVID. We had also invested in a center of excellence called the Center for Epidemiological Modeling and Analysis, and it provided very useful information around when we're going to get the peak of the pandemic, how this was going to manifest itself in each of the provinces. And this expertise of analyzing the evolution of the pandemic was not only useful in South Africa, but we then provided this expertise to some of the continent of Africa. And then perhaps lastly, just to indicate that we didn't do all the work alone, President Ramaphosa, as the chair of the African Union, participated in the COVID-19 Global Pledging event, which was hosted by the European Commission. And in this event, we, South African government, pledged to invest about 25 million in the BioVac, one of the local companies that are manufacturing vaccine, to ensure that Africa has appropriate capacity for the manufacturing of vaccines. So a number of companies and countries have been then working with us to see whether when the vaccine is available and the tests show efficacy, we would then be in a better position to then make sure that this is done for the rest of the country. So what are the take-home messages that we have picked up is that the investments that were made in science as early as 2001 and in certain instances in 2006, we were able to repurpose these very, very quickly because of the scientific capabilities to support the fight against COVID, whether it was testing, reagents, manufacturing, the development of ventilators. We demonstrated the importance of investing on an ongoing basis in science, technology, and innovation. And what also happened is that because we were able to demonstrate the manufacturing capabilities and the research development that was done in the manufacturing of the ventilators that I showed, we have now been asked to contribute to the economic recovery by identifying the contribution that science, technology, and innovation can do in the reindustrialization of the country. And then, as we indicated, we've always valued international partnership, and we continue to make sure that solidarity with other countries is important, not only in the execution of COVID-19, but in making sure that scientific excellence is drawn from the rest of the continent and the rest of the world. Thank you very much.
Wonderful. Thank you so much for our wonderful speakers, not only for their wise words, but also for sticking to time to enable us to have an interesting discussion with the audience. So first of all, we've got a couple of questions coming in about the importance of the social sciences in combating this. And I just wanted to pick up on something that Missionary, you mentioned the importance of citizen empowerment and citizen involvement in all of this. Now, I was reading Nature magazine this week, and there was there's an interesting worldview perspective in Nature, and the author is arguing that we can't tech our way out of the pandemic, regardless of who we are or where we are. And she argues that we must take into account racism and structural inequalities in our approaches to combating this virus. And I think for me in the UK, that was really marked when earlier in the summer, the UK government sent out hundreds of thousands of tests and was surprised that 2/3 of them didn't come back. I think anybody that really understands or appreciates kind of structural inequalities and social inequalities would probably have predicted that. So I just wanted to really ask all three of you, do you think that scientists and the science community has really thought about these inequalities to the extent that they should? Anyone can answer this question. Jump in, please.
May I?
Of course.
To be honest, at the first time, this March to May, we are short of the reagent for the PCR. And actually, we had a discussion who should accept the PCR test. And in our case, well, as a whole society, we chose that we should focus on the patient with a severe symptom and let them treat as a first choice. And for the others who has no symptom or just a cough or fever, let them stay at home And we asked them to consult every day to the doctors and also check by themselves their body temperature. We had a kind of guideline to maintain health by themselves, rather than just let's go the hospital, rush to the hospital. Then the hospital will be crowded and we cannot manage well. So we need to settle down the acute phase. And later, I guess we are somehow successful. Almost every day we inform the scientific information through TV and internet, and we have a discussion through TV, and people understand. And we can pass through the acute phase that might be May to June. And then we reach the stable condition. That's the way we experienced. Although we couldn't have enough reagent, now we have, but we have to prepare well organized system at the time to treat people. And now another point I want to mention is now we have the figure, what the total figure of this infection. For example, under 50, we don't have a high incidence of deaths. It is only 0.5%, but older people over 80 years, 30% of the patient passed away. So we should focus on older people and isolate them and let them keep safe. This is the way we tried. So now we can figure out the total figure of this pandemic disease. Now we can keep well our society. I think this is the way we are trying in Japan right now. Thank you.
Thank you. Do either Mike or Phil, would you like to comment specifically on sort of social sciences or the contribution of social scientists and so forth before we move on to some of the other areas? Because there's plenty to discuss.
Yeah, I think
Gail. See, Mike wants to go first. I'll come after him. Okay,
thank you, Phil. I think just one thing we could mention, and I know that's been done in many European countries, is to look at questions in our different national situations of influence of things such as national origin, social status, favored or defavored populations. And what we have found in many European countries is that people of foreign origin are more exposed. People of lower economic categories are more exposed. People in less favorable situations are more exposed. And the likely explanation is that these people are living in smaller housing facilities. They're living closer to each other. They don't have the possibility to avoid being in contact with people who have the disease, et cetera. And so in some ways, I would say that the social scientists are telling us that a pandemic like COVID is actually revealing inequalities in the society. It's practically a test to see how unequal the living and working and housing facilities are for people in the society. So I think that we should be looking at those aspects. And again, coming back to what Michinari was saying, the behavioral aspects of this. We've noticed substantial differences between the different European countries, depending on their national culture, as to how they deal with the way the information is provided to them and their individual or collective responsibility. And I think that we should be encouraging, and again here speaking as the president of EuroScience, encouraging us to really integrate the social sciences into everything that we're doing, whether it be the acceptance of the measures, the social distancing measures, going to look to the future. In my country, where I live, in France, there's a substantial anti-vaccination movement. So we would want to look carefully at how we present the new vaccine, even if we do find one. And I think these are not just technical issues. They are much, much more social and societal issues. And we should be, as scientists, integrating our colleagues from the social sciences into this so that we can better understand the best way to go forward.
And Phil?
Yes, just two quick points, Gail. Thank you very much for the question. Well, because of our history in South Africa, I think you would know that because of that, when the pandemic was playing itself out in South Africa and we introduced the lockdown, you would then understand that the lockdown in affluent areas was adhered to more than in not so affluent areas. And if you take that at face value, you would say some people are not keen to follow the law. But as Michael says, if you're staying in a dense area and you are asked to social distance, how do you do that? And therefore, as just one example, there are many, many, many others that showed in South Africa, even when we analyze the spread of the pandemic, therefore, you would see that the inequalities were also giving the kind of patterns that were showing you that inequalities is also playing a role in how the pandemic is playing itself out. And what this has done is it has also brought the social scientists closer to the natural scientists to see how best science, or if you like, biomedical or natural science, have got to be informed by what's happening in social science. Things such as planning cities, it's going to be important. How do you plan cities so that you've got the right spaces? So this has become important. Behavioral issues during the pandemic have become very, very important. And therefore the social scientists, in fact, as we speak, are working with the natural scientists as well as the economists to try and say, as we now coexisting and co-living with the pandemic, where is the optimum period between making sure that you maintain and contain the pandemic, but at the same time you get proper economic recovery, but an economic recovery that is inclusive. So it's extremely exposed society in a manner that has not been done before, and also gives us an opportunity as policymakers to then think about how do we get this open science concept in a reality going forward. Thank you very much.
That's lovely. Thank you. I'm really pleased that we managed to have time to discuss this issue, because I feel very, very passionate about this issue. And I think what I would add to your list, Phil, is the importance of the science community to really build strong relationships at the community level, which I'm sure all of you do already. But the trusted actors at the community level who have trust in those communities, I think it's important for scientists to reach out and build relationships with stakeholders that perhaps they would not normally have done. So thank you. And so moving from the local level, I wanted to say that all of you mentioned the importance of international cooperation and thinking about this as an international pandemic. And as Catherine Guinard from the Wellcome Trust said to me a few months ago, no one's safe until everyone's safe, highlighting the importance of all working together. And I've got a question specifically for Mike, since this is a European, I guess, issue particularly. The European Commission and the European Parliament are one of the latest buzzwords or buzz phrases is technology sovereignty. In other words, thinking about disruptions in supply chain issues and various technologies that's encouraging Europe to become more resilient and to do things itself. And the pressures, I think, on Europe as a whole, or even at the country level, to appeal to your own individual citizens when you're responding to the pandemic, in a way is counter to what we know as scientists as being an international approach and open science being the most effective way of fighting this pandemic. So I just wondered if any of you would like to kind of comment on these conflicting, seemingly conflicting issues of needing to act nationally for your own citizens, but actually also act at the international level.
Well, Gail, since you mentioned me, and of course the reflections that are happening on a geopolitical level around the world, I think immediately of the phrase, no man is an island. I mean, if you, I have an anecdote. I think many of you followed this story a few months ago. There were questions about contract conditions for vaccines in different parts of the world, and in particular in the United States. There was a concern in my home country in France that there would have been an exclusivity contract on a possible vaccine produced by a French-based company that has production operations in the US. This created quite a bit of emotion, actually, on the part of the French population. And there were movements, of people saying, well, maybe we should forbid this French-based company from selling its vaccines in the US, because even though they have production facilities, maybe we should even take the production facilities and bring them back to France. And then the government made a statement which I thought was actually quite sensible. And they said the following: no one is sure which of the companies in the world is going to be able to develop the vaccine. And so it's not in the interest of the French national population to have an exclusivity contract with a French pharmaceutical company if the vaccine is developed by an American pharmaceutical company or by a Swedish pharmaceutical company. And so I thought that that was an exceptional case of lucidity and pedagogical language on the part of a government that is very often pushed by populist concerns to follow these sort of instincts of the population, which are actually not thought through to their logical conclusion. If we need something and someone else can share it with us, we should be able to do that, and everything cannot be created in your own backyard. Now, having said that, of course, it would be nice if each of the individual countries were able to perhaps increase certain capacities in certain areas, but it is absolutely impossible to imagine that our individual nation states in today's world will be totally self-sufficient in anything. And I think that we have to understand that international relations are going to be at the heart of all of these things in the future. And there is no way to put up a barrier and to just keep everyone to himself.
Thanks, Gail. Just a short support to what Mark is saying. We in South Africa and perhaps in Africa know the consequences of that more than anyone else. If you have your neighbors that are battling and you have something and you can't share it with them, whether you like it or not, it's going to be your problem. So even in this pandemic and this vaccine and all of these things, we have learned that you have to continuously remember that this supply chain, they may be broken because of the borders. In fact, one of the things in South Africa that was agreed earlier on in terms of the regulations was that the supplies will continue to be made available. And as you know, even though the borders are closed and we are stopped from flying as individuals, but the goods continue to move around. So I think, for me, even though initially we may be worried about those of us or in our own countries get the vaccine and being protected, as long as you stay in your own country and you're not expecting others to come and infect you, then it makes sense. But we do know that that's not possible. So in my view, I think if it does happen or if it has happened, it's just a fear as human beings. But ultimately, I think we'll go back to a supply chain that is globally connected as we have been doing before. And I don't think that it's possible to go back into tariffs and protecting borders and protecting your own knowledge and assuming that it's only that knowledge that will make you survive. as a nation. But that's just from our perspective here in South Africa and Africa. Thanks.
So we've also got quite an interesting question that's come in from the audience about the science and preparedness. And the question is, or the point is, do you think that the whole preparedness, the science of preparedness, was not visible enough to the public? So the existing plans were not communicated to the public in terms of what we have learned up to now before the pandemic that helped us prepare effectively for this response. Would it have helped us to, do you think the preparation of the populations and the plans already elaborated could have contributed to the timeliness and efficacy of the response? Hard one to know. I see shaking heads here. I see lots of thoughts. Missionary, would you like to, you have your hand up there?
Yeah, I'm not sure whether I can answer well, but science has some uncertainty always. And the role of scientists is, I think we should explain what is clear and what is unclear. We have to explain carefully. And in case of COVID-19, we already experienced several months, and we know already the character of the COVID-19 and what is the risk and what is not risk. We understand by our experience. So we should spread this information to the people. For example, the virus remain on the table or wall or doorknob for several days. If we touch with raw hand, we can be infected later. So we have to clean up the hand after we touch something in a public place. This one simple information, but it is essential and sometimes it's critical to the people. So I think we scientists should explain in a simple, clear word what is a dangerous situation, what you can help your health. This is a way we need to explain right now as a scientist.
Yes, right? I completely agree with you. I remember watching the political leaders in the UK very seriously saying that they were following the science. And I remember thinking at the time, well, I think the only thing the science is telling us right now is that we need more science. And not the definitive answers. I mean, this, as you say, the landscape shifts so quickly because this is a new situation. We're learning so many new things all at once.
And we should explain, as Michael said, vaccine is not the absolute treatment. You know, we are not yet sure whether it is effective or not. So we need other way to prevent infection. This is a role of scientists to explain carefully.
Absolutely, I completely agree. Would anyone else like to jump in before I go to my next set of questions?
I just wanted to come back to something that I mentioned in my initial remarks about what I called the living corpus of knowledge and facts. It turns out that what happened in this particular case was an acceleration. You know, it's like when you fast forward a movie. You know, it goes much faster. Normally, the scientists take a little bit more time before putting out their hypothesis in the public. So because of the urgency of the crisis, a lot of things were happening quickly. And that means that we were revealing to the public what Michinari was telling us that the public should already understand about the scientific method, is that it is based largely on critical examination in periods of uncertainty. The problem is that process is generally slow and not interesting to anyone on the major news networks. And, nobody's reading the editorial page of major journals and this kind of thing. So it's not so. And then I think, at least in the populations in Western Europe in certain areas, people were shocked. You know, they thought that these scientists should know the truth, you know, and why are they bickering with each other and why are they criticizing each other? I think that that's perhaps an opportunity for us as scientists to better explain to the general public how we work. But of course, we might go through a little danger zone there where maybe trust will drop a little bit for a few months. But I think that overall, this is an opportunity for us and we should take advantage of it. Like Michinari said, explain better what we are, what we do, what we can do, and what we can't.
And also when we get things wrong, because the science changes something else.
Exactly.
I think that's the self-reflection is really important as a scientist, I think. Yeah. So I was going to now turn to things we've skirted around this for a while, but the role of scientific advice into governments. And I know this is being discussed already at some of the other sessions in ESOF, but I just wanted to raise it here again. I don't have any evidence, but it feels like that those countries with less developed scientific advisory mechanisms fared just as well or just as badly as those countries that have quite extensive scientific advisory mechanisms. Possibly. Discuss. What does that tell us about the efficacy of the science advisory mechanisms? Are they working or not? Anyone? Jump in.
Okay.
I'm going to jump in on this one because it's something that I think is important to think about in a different way. One of the things that you learn when you study systems and you look at systems in general, whether as a scientist or a technologist, is you look at characteristic timescales. And I think what has happened here is that we have confused some of the characteristic timescales. In other words, the time it takes for you to determine the DNA sequence of a new virus is now very, very short. And so we had available to us as early as January or February a clear model of the genome of the virus. Treatment methods for curing or treating a previously unknown viral ailment regarding the virus of which we know the genome is a totally different type of research activity, and it happens on a totally different time scale. And the reaction of the governments to their scientific advice mechanisms is asking all kinds of questions on all kinds of levels of timescales. And so I don't think we can conclude from the difficulties that we've had this time that advice mechanisms are totally failed structures. I think they have to be adapted in the kind of advice that we're looking for. I think the problem we're having here is that we're asking the advice mechanisms to do too much, and we're not clear about what it is we actually want from them. And that's something that can be improved in the future. And I think we're here in a session called Lessons Learned. I think that's a wonderful opportunity for us now to look forward and see how we can adapt these advice mechanisms to make them more relevant.
Thanks, Gail. What we learned in South Africa, maybe one or two examples, is that sometimes science advice was presented to the decision makers. But if you advise, like in our case, on the biomedical side of what you understand of the disease, and that decision is not taken in its totality by the decision makers, because the decision makers have to take into account the social and the economic aspects of how the pandemic is impacting on the social. Is it bad advice? Or is it advice that doesn't take into account how the world works? Because we had a number of those in South Africa where the technical biomedical advice made sense from the scientists who then presented this to the political principals. But the political principals say, I mean, in our case, it was an issue of the lockdown. Because we are approaching the peak of the pandemic, do you continue the lockdown in order to get the readiness of the hospital facilities? The biomedical epidemiological modeling, with these assumptions that it had, was very, very clear. But how long do you sustain that when people are hungry and because they are staying at home, their livelihoods are affected? So for me, that's a lesson that even in this space of scientific advice, we need to learn that the world now is much more complex than before. And therefore, we appreciate that we may provide advice as scientists or scientific community to decision makers who have to balance not only just the scientific advice, but the human conditions, the economic aspects. And therefore, as we continue to look at how best we provide advice, we have to also look at the changing world and the changing landscape of how we need to respond to the global challenges. I guess it's the same issues with people who do scientific analysis of climate change, and they have to make these recommendations to decision makers who have to say, what do we worry about? Do we worry about shutting our coal-fired power station when we have a lot of coal? Or do we worry about the generations, 2, 3, 4 years generations from now? So these are not complex set of issues that I think scientific advice can only be blind to the complexities of their role going forward. Thank you very much.
Good point. Missionary, I'll ask you to
I want to say one point. In our experience, we found that sociology or information technology were very important. It is important to study the viral structure and the pathology. This is very important issues, and the development of vaccine is also important. But besides this field, sociology and information technology is very important, was effective. In our case, through the information technology, we analyzed the cluster and the early phase, for example, late March to May, we tried to stop the infection by identify the cluster and the development of the infection through in the local community. It was very effective. We can reduce the infection. And so that means science is not just virology or immunology or vaccination. Science includes a wide range of idea, knowledge. And what scientists should try is we have to apply these ideas. But science advisor is advisor. Decision should be made by politician. And we should remain as an advisor, but offer proper knowledge to the politician. This is the role we tried in Japan. Is it okay?
Moderator error of leaving mute on. Thank you very much. One of the questions I have here, which I was going to ask at the beginning, was how can we prepare scientists better for the next crisis? So not the government, not the journalists, not the public, but the scientific community itself. And I've been reflecting on that question in the context, Phil, of what you said earlier about the scientific advisory mechanism and understanding that the world is more complex. Does this mean that how we can prepare scientists better is to really promote multidisciplinary working a lot more than we have been doing up to now, or not? Could you give me your thoughts, all of you, on that thought? Because we've also talked about including the social scientists. I feel this is a point that's coming up in the scientists' training from when they go through, then do their PhD, and they're almost trained to be narrow and deep, and not necessarily broad and understanding complexity.
We need a generalist, a kind of generalist, and it depends on human resource development, and we need to improve the teaching system in university, higher education. In our case, Japanese universities teach a narrow range of information, and we need generalists to cover a wide range of science. And as a one person, one scientist, we need two factors, generalist and specialist. These are new type scientists that we need to develop in our education system. I don't have a complete answer, but improvement of the graduate school is important in case of Japan.
Gail, I think it's an interesting topic, and perhaps not an either or, but I think I would share the sentiment that says you need both. But sometimes as a generalist, you need the deep, specific knowledge of a particular area for you to be able to generalize. And therefore, the scientific advice and the structures that you put in place probably do need discipline-based, if you like, advice, but it's how you integrate it into the real world and how it works. And we in South Africa were lucky to have an Academy of Sciences that has scientists across all disciplines, but how well they work across the disciplines, I'm not so sure. So I think the idea of really multidisciplinary and working across disciplines is something that I think as scientists and as policymakers, we still have to figure out how best you get the right balance and how do you actually incentivize for that to happen and for scientists to learn each other's techniques and how you then integrate these things. As I say, in South Africa, we worried about the economic growth. We are worried about the pandemic. We are worried about inclusivity. Now you need people who are going to optimize within these three variables. In maths, it's easy. You can parameterize across the three and put it together, but to get scientists to work across these is something that I think it's going to be new and that we all have to work towards in the next coming years. Thanks very much.
Thank you. It just reminds me what you've just said is, I mentioned at the beginning that I've been involved in ESOF since it started in 2004. And when we started ESOF, scientists didn't really understand what it was for. A lot of scientists, they were, well, we're not going to come because we're a cell biologist and we go to our cell biology conference, or we're neuroscientists and we go to our neuroscience conferences. Why would we want to go to a general science conference? And I feel like the movement of trying to get people to be more multidisciplinary or wider thinking in their approach has changed since 2004, but there's still a long way to go. Mike, would you agree with that?
Yes, I would agree with that. I also would agree that there's a tremendous amount of work yet to be done, but I would like to just explain it a little bit differently, perhaps. Well, first of all, I'd like to make a small advertisement for a session that took place yesterday on, we had a session on the skill sets for the younger generation of researchers. And it was very interesting because we had three panelists, like we have here today. And there seemed to be at first a difference in opinion between two of the panelists. One suggesting that the best training programs in universities would be multidisciplinary, and the other suggesting that it was absolutely necessary to have specialists with deep knowledge of specific areas in order to be able to make real progress and innovation. And I pointed that out to the panel because I was doing the role of Gail. I was the moderator. So I said to them, it seems to me by listening to the two of you that you don't agree with each other. And so I asked the other panelists who had talked about the multidisciplinary approach. And she said to me, that's not exactly what I meant. I didn't really mean that we wanted the sort of the Renaissance man, with somebody who knows everything. She said what we should be thinking about is more a T-shaped structure. In other words, someone who has an anchor in a specialized deep knowledge in one area, but a broad ability to dialogue and work in teams with multidisciplinary colleagues. And I think that is, and it was interesting because the two panelists then said, yes, actually, we agree with each other. What we want are specialists who are sufficiently curious have the dialogue skills sufficient so that they can work in multidisciplinary teams. And it's not going to be the result of any individual in the team that's going to make the progress, but the team itself as a collection of individuals who have that one additional skill in addition to their specific disciplinary expertise, which is dialogue, the ability to dialogue. And there, of course, this is what ESOF is all about. And so I was extremely happy to see that that panel really came back to what Gail is saying. This is why we created ESOF in the first place.
Missionary, would you like to, we've got just over 2 minutes left. Would you like to have a comment on anything that just as a sort of sum up comment on anything that struck you?
As Michael said, we are trying to foster T-shaped researcher in Japan. And one way is we offer a chance to the student to experience different field. And sometimes we offer them internship in company. This is one way. And another point we are trying to manipulate for this issue, we will start a new program. We call it SOHAS. We collect a small group of different specialties and let them try something together to improve our future. This is a new program we are now just started. So
perfect.
Let's try anyway.
Sounds good. Phil, would you like to say just a few words in your closing remarks? Something that struck you?
Just to say thank you very much to ESOF for inviting me, and we hope we'll continue the conversation next year in Cape Town when we host you to the World Science Forum. Perfect.
So I would just like to close by saying I really enjoyed this session. I just want to thank all of you for taking part, not just the speakers, but the audience for their wise and wonderful questions, but also behind the scenes, all the IT and technical support that's enabled us to do this quite seamlessly this afternoon. And my final point is that one of the other reasons I've enjoyed this session is because often I'm in sessions where the scientists say, the problem with the public is they don't do ... The problem with journalists is they don't do ... The problem with government is they don't do ... And I feel we're starting to be reflective and saying as a community, the problem with us is that we need to do ... So I feel like we're sort of shifting that debate on, and I've really enjoyed speaking to you today. Thank you so much, all of you.
Thank you.
Bye-bye.
Bye-bye.
Okay, bye-bye.
Bye-bye.
Bye.